Good afternoon, everyone. And this is the Board of Health May monthly meeting. Today is Thursday, May the 4th at 4:33 for the record. And I am Ina Mordizio, Director of the Board of Health, and I'm turning the mic to Dr. Brophy, the chairperson of the board.
So let's bring the board meeting to order for the month of May. The first item on the agenda is approval of the minutes from our March 2nd meeting. Mr. Fisk, any changes or any issues?
No, I approve them as seen here. I approve them as read, yes.
Okay, so the motion is forward. We both approve. The minutes are passed. Next item on the agenda, Mr. Doucette, you're here with us today. It's reintroducing the issue that we discussed at our last meeting. Mr. Fisk, we did not have a quorum our last meeting, and we were on. We met with someone from the company of the Family Dollar stores, the ones located at Center Street in Brockton, and the other that's on North Martello Street, for a number of issues. So Mr. Doucette has been working with the company, and maybe Mr. Doucette, since Mr. Fisk was not here, maybe you can go over what the issues were last time and the discussion that we had with the company about moving forward and what was required. So, and maybe give us an update on what's happened over the last month.
Yes, certainly. So the issue arose due to non-compliance at two Family Dollar locations, that being at 725 Center Street and 880 North Montello Street. And the issues were that the grounds on the exterior were not being maintained, and also at each location there are dumpsters that are not enclosed. So subsequent to our meeting last month, I have noticed that exterior conditions have improved. Indeed, today during my inspections, I saw at 880 North Montello Street, there was a landscaping crew present and they were caring for the exterior of the property. Also at my reinspection of 725 Center Street, I saw that the exterior of the property from a trash standpoint was in compliance. However, since the date of our last meeting, the dumpsters have not come into compliance. They are not enclosed. If you recall, at our previous meeting last month, we had met with the district manager. Her name is Francisca Perdomo. She could not be present today as she is out on a short leave of absence. But the dumpsters have not been enclosed. This item has been open since November of last year, so more than 5 months now. So due to the lack of compliance, I issued monetary citations. If this board sees fit, I would seek a civil action in court to insist that compliance be achieved.
And when can I ask, when were the fines levied against the company?
Yeah, it was last week. I believe it was on Friday.
On Friday, okay. And
Did you hear any response from them once you levied?
I have not had any contact. If you recall, at the last meeting when the district manager was present, she stated that she wouldn't be able to be present at this meeting,
right,
but that the properties would be brought into compliance, which I feel, given the weather and given that the issue has been ongoing, I feel 30 days at this point to enclose dumpsters is reasonable.
At least a plan in place to close the dumpsters. So should be in place, or they should notify us. I mean, there may be issues with getting a company in, etc., but at least some documentation that the issue is, since last month, there is a plan and they're executing against that plan to get this to happen. Mr. Fisk, this has been going on since November. We met with
I know.
They have recently gotten a fine for non-compliance at this point. I think the issue is, bringing civil action against them. And Mr. Doucette, I'd like your input on this, whether we give them, since the representative from the company hasn't gotten back to us yet, that we say by the next board meeting, we will start the action we will start action against them. We'll give them time to get back to us with the fine and time period, and they have to give you a proven plan that they have, they have a company hired, the dumpster is going to be placed. The surroundings of the dumpster are going to be in place. They had landscapers there today. Well, whether or not they're going to complete the job or not, we're unaware of. They just got the fine. I would say by the next meeting, we will begin the action. If you do not have proof that this has been taken care of, that the plans are in place and that they will be putting the dumpster in, it's either in or eminently going in place. I think that gives us at least time for the company to get back to us after the fine to just let us know for sure. I feel a little uncomfortable starting an action now where there may be plans already in place and we're just unaware of them at the moment. And I don't know if you agree with that or if Mr. Fisk agrees with it.
Yeah, I certainly agree with that. I think that's only fair, but I think that he has to let them know about that the civil action is coming within the 30 days, so they know that, and that we want to see some type of plan, but they need to be notified about it and see if they get back to us, and then we'll see what happens the next meeting. If they haven't gotten back to us or at least given us a plan, then we definitely have to do it.
Right. So I would vote, this is by June 1st. So our next meeting is June 1st. And I don't know if we have to contact the law office or whatever to begin, but the plan would be if we do not get, I think we can vote today to say if we haven't heard by June 1st at this board meeting that we will begin the action.
Yeah, yes, I agree with all of that. I would have accepted an incremental plan like engineering drawings or something of this effect
Right.
to state that they intend to enclose the dumpsters. Having not received that, I think that they don't either A, have the willingness, or B, the ability to go forward and enclose the dumpsters to bring them into compliance. So I agree with you. Yes, the law department would be partnered in. The complaint would come from one of the counselors in their department. And also, yes, that I would send a notice to the Family Dollar Corporation to tell them that legal action is imminent if compliance is not achieved.
Okay. So George, I'll make the motion that at this meeting we are voting to begin civil action if we do not have a plan and if the company does not come with a definitive plan that these dumpsters are in the process of being put in place, either with plans or with documentation that they've worked with a company and have agreements with company to get these dumpsters enclosed at their sites. And if not, then we will begin civil action will begin on June. We'll file for whatever or do whatever we need to start the civil actions on June 1st, and that Mr. Doucette will notify them of the pending civil action against them.
I second the motion. Fine.
Okay. So our vote is
Aye.
aye. And I think we have a plan, and if you'll notify the company and legal and et cetera here, and then we'll hopefully something will be, plans will be given to you and we'll be ready to, hopefully they'll come into compliance.
We do hope for that. And
Okay.
we thank you for your time.
And thank you for
Thank you.
updated on
Thank
this.
you.
Yeah. All right, thank you.
Good day.
Good day.
Bye-bye.
Bye-bye. All right. So next is just any updates on moving forward with the life science bio-ready community activities. We've had a couple of good meetings and some help from other towns and folks that are experts in this field. And I think we're getting at least some ideas of what the city needs to do. I think the last meeting we talked about trying to get some help from consultants that would help us sort of formulate the plan, and maybe you can fill us in on where we.
Yes, thank you. I
Yeah.
did take the subject matter to the attention of the mayor
Okay.
because I was a little bit hesitant to talk with consultants, potential
Right.
consultant, without knowing if that would be the course of action that the mayor would agree with. So I discussed this with him, and he agrees that we will do that. He's looking into through his CFO.
Okay,
He's looking to see what that might cost, and I'm also looking to get some quotes. But at the same time, he is going to reach out to Mr. Rob May from planning
right,
to see what advice he can bring in terms of consultant, because it seems that there are a few pieces that the mayor would like to see come into congruence in order to be able to move forward and get a consultant, if that's the way we need to go. So I do have the names of the consultants. So once the mayor speak with Mr. May, and most likely we'll come together and have a call make a call to the consultant, potential consultants, and have a discussion.
Okay.
Yes.
Yeah. So, Mr. Viss, we've been, there's been a number of meetings that have taken place, and I think we want to move forward with this in the city. It's finding the right level and what the city expects to do, and what we have to prepare for at the Board of Health, and the overall cost of what it will cost for looking at approving and then monitoring these facilities as they go forward, and within the guidelines that are out there for recombinant DNA type of manufacturing within the city. So and there's various levels, and I think our advice was to stay, in the one sort of 2 level, and not to proceed higher than that, which is what most communities do. It's it's rare communities that move up to the higher levels of other products that may be more of a health risk to the community. So, but it would be it would be good for this. For many communities, many of the communities around here are already have opened such businesses and have these guidelines in place, and I think we should move forward as well.
Sounds good to me.
Yeah. Okay. Any other comments or?
No, that's basically it for this one.
Okay.
I spoke with the mayor actually on
Yep.
Monday. We had a meeting at his office.
Yep.
And probably he will take some time to speak with Mr. May.
Yeah, it'd be good to have Mr. May back in the,
Yes.
Right. Good, and happy to meet with him at any time. And we're also, there was an invitation, I think, there's Cambridge is holding a meeting about this, and
Yes, actually, thank you.
Yeah.
They're having 2-day meeting next week.
okay,
And there is one night that I can attend. That's the 9th.
okay,
The following day I can't make it, so I'm looking to see if I could attend at least the first day
okay.
and get as much information as possible.
So the city of Cambridge has a large biotech industry in Cambridge, and a very high level of industry in that area. And they're holding a conference for other communities that are doing this, talking about the safety issues and the guidelines around it. So thank you for attending, and I'm sure it'll be very helpful for us.
Thank you.
Okay, great.
Thank you.
So I guess next issue is, did I miss something?
Health inspector, the sanitary inspector.
Yes, the health and sanitary inspectors.
Yeah. So what's happening is the health inspectors are pretty much between 2 places, but somewhat officially they are stationed at City Hall at the building department. I would say that based on the plan that the city council approved in the last 2 weeks, the health department is going to be, well, the Board of Health, to be accurate, is going to be moving from Board of Health to Health Department. Now, the proposed plan is to have a Health and Human Service department.
Right.
Now, under that, there will be several departments. I don't know exactly what specific title they will name them, either bureaus or divisions, what have you. But under health and human services, that's where the health department will be under. And so with the inspectors, they under the report here, because of the reports, all the complaints or all the codes and enforcement are handled by the by the Board of Health right now. But moving forward, probably into FY24, which starts July 1st, so there will be some big changes coming
Okay,
up.
all right, yeah. And my understanding is sort of the building department, there'll be a separate sort of health related to the buildings and building inspectors outside of the health department, and
Yes, the organizational chart,
right.
I am yet to see what it looks like, or the finite plan, because I know building will be somehow part of this process,
Right.
but I don't know, I just don't know exactly on the organizational
Sure.
chart what exactly it will look like. But the inspectors, I think they looking into making some inspectional service inspectors.
Right.
Yes.
But clearly the health related, the restaurants, the et cetera, will still fall under the
Well,
Yeah.
it is my assumption that this will be, because obviously
Yeah, sure.
obviously all the codes and regulations that they fall under health,
right. Okay.
for that matter.
Right.
Yes.
I mean, that only makes sense because you would, if there is an outbreak of something, it's clearly the department's tracking sources, et cetera. If we have an outbreak of hepatitis B or something in the city, it has to be tracked or
salmonella, what have you.
salmonella or hepatitis E, like to track it back to the source in the city, and that's usually done in the health department and by the epidemiologist, et cetera, that are involved. So we'll wait to see what the plan is, notification of what changes will be taking place.
Certainly. And so for now, the vacancy we have for an inspector here is kind of on hold, because I think the uncertainty is what the next, what the transition is going to look like, and where will that inspector fit?
Right.
Will he be, or will he or she be a health inspector, or will that person be just regular housing inspectional agent? So I don't know.
So all three of the positions currently, we have one sanitary inspector, an administrative person, and a code enforcer that are on hold at the moment. Are all three on hold? Correct.
Actually, at my last meeting with the mayor, we have a go-ahead to start interview for the admin one position.
Okay.
We have received about 13 applicants, and so actually there were 14, but we're looking at to interview most of them as soon as the HR give us the green light.
Okay.
Is able to schedule the interviews.
Okay. Mr. Fisk, any questions or?
Well, it's just that, it's hard to know until we finally see what the final situation is going to be, and, with this new, health department. So it's hard to, to even pick anybody until we find out if they're going to be needed or whatever.
All right, so we'll move on then to the some of the statistical data around COVID and dealing with the COVID dashboard and how the city is doing, and as well as the vaccinations for COVID. So you can take a number of the items together.
Yeah, the data is very reassuring because we see all the numbers are moving in the downward directions, and that's the numbers on Maven, because in recent days, the numbers are in the single digit. And even though we know that this is only cases that are PCR or other different tests, but none of those reflect the home test kits.
Right,
But when we look at the water, the wastewater,
yeah,
the numbers also are way below
yeah,
1 million,
Yeah.
because for the most part, the numbers remain over, the concentration remained over 1 million.
Yeah.
But right now it's about 400,000, 500,000.
Yeah.
So
yeah. So it's almost a 50% drop, and it is a 50% drop in the last month of COVID infection
yes,
by
absolutely.
water. Yeah.
Yes,
Great.
absolutely. And
Wonderful
then,
data.
yeah.
Yeah.
And then DPH is going to start providing the dashboard regularly. The last one they made available goes back to last Friday, April 28th. And at that point, there was 0 cases at the hospitals, 0 hospitalizations. So that's a good move.
Yes.
So we're looking forward to continue to work and monitor cases and any case that we have. And also we will continue with vaccinations at the Shaw Center, because it seems that having a place where people who want to get vaccinated can still do so would be a good idea. So until further notice, we will continue, our public health nurses will continue to do vaccination at the Shaw Center. Now, today, as we speak, there is a clinic also at the Cape Verdean Association. We hold that clinic every other Thursday. The numbers are not great. Sometimes it's 2 individuals or 4 or so. So we might combine the Cape Verdean Association with the Shaw Center clinic and have just one day clinic there.
Right.
But after today, we will see. Now, one thing that we know coming up as of next Thursday, a week from today, the CDC and the State Health Department is going to remove the public health emergency declaration that was passed by the Washington administration, President Biden. And so that means that many of the services for COVID will be discontinued, but we know that there will be some protocol. But we're waiting for the announcement by next Thursday to see what exactly will remain and what will go. So that's where we are. In that plan, well, a little bit before that plan came into, was announced, CDC and DPH have also agreed to discontinue all monovalent vaccines.
Right.
And that includes Pfizer and Moderna. So which means right now, everyone who is getting a dose will receive a bivalent vaccine. So that's what we have. And so for people 65 and older, they are encouraged to get a booster also. And those who are immunocompromised, they can also get one. And individuals who are 12 years old and older, who have not received, say, they did not receive a first dose, they can get the bivalent and then get a booster at 28 days later. So those are some of the changes that have been made, and the nurses are working to continue to handle that. So I believe that's basically the extent of the data,
Yeah.
COVID data.
No, it's very encouraging to see that it's dropped so rapidly, and the vaccines are, the boosters are in, it's after 6 months for those 65 or those that are immunocompromised. As the recommendations are for those individuals at 6 months, around 6 months, if they've been boosted in the past for a repeat booster. So,
Yeah.
great. And some of the mask mandates are probably going to go away as well, even within healthcare facilities. I know there's a lot of information about that going on right now and some controversy around it. But anyways, the the mandate, many of the mandates are going away.
Yeah, I think we'll have to wait and see what the CDC and DPH.
Yeah, and whether or not a new, the bivalent is out there now, but the variant has changed, the more common variant has changed. So whether or not newer formulations and, the long term, this is a new virus that could be, like the flu that we periodically have to get vaccinated for. So we're all anxiously awaiting to see the recommendations that the CDC are going to make and with the new types of vaccines, new formulations can be, depending on the variant. But, hopefully it'll be summertime will be a lull rather than a surge that we used to have, and things will have all be heading back to having somewhat of a normal existence here.
Yeah, just a minor addition.
Yeah.
As of March 29, DPH has suspended the incentive cards. Gift cards incentive
Right.
that they provided at a rate of $75 per card per person.
Yeah.
But the $25 gift cards that CDC has provided, they remain in effect until further notice. So which means that people can still get a booster and get
some
a small
incentive
gift.
stipend. Yeah. Okay. Great. And then let me see where we are on the agenda here. So that moves us down to the health promotion and public health education.
Yes, that is what we continue with. And we are also looking to make some changes. During the pandemic, DPH has given city of Brockton money, $1 million at a rate of $500,000 for FY23. 22, and then FY23. So they have provided under such protocol with some explanation around scope of services. So under that, we were able to hire case investigators, contact tracers, and then epidemiologists. So right now we're looking to see how we can continue to provide services to reach out to the community. So in order to do this, we realized that DPH has made some significant changes in the scope. So we in the city are looking to make those changes also. And so we would like to retain the case investigators. We have 2 of them that have been working. So instead of calling them case investigators, contact tracers, we are training them to become community health workers.
Okay.
And we will allocate money, the city, to pay for them. So as community health workers, they will be doing public health outreach and education. But before they do that, they're undergoing a training with the Boston Public Health Commission as of next Tuesday, May 9th. And that's a training, it's an 80-hour training. The training will end around June 8th. Okay. So that we will be able to transition to, the case investigators will be able to transition from from what they were doing under the COVID pandemic to addressing the real need and health challenges of the city moving forward.
So where will they, as they move forward, and this is with mental health, where are they going to be linked to the community health clinics, or what's the plan?
They will be working alongside the nurses. And we will be stationed together because we have space for them, and we want them, they will be in person. Okay. And so therefore they will accompany the nurses as they go out, and also they will help to implement the health need assessment, which is a community health assessment. For the first time that the Board of Health has put out such document. And basically, we're taking seriously all the challenges, the needs that the city has in order to see exactly where to put our priorities.
So this is the questionnaire that went out to the
Yes,
city.
yes,
Yeah.
and thank you for the question. It has been posted on the Board of Health website, and also the mayor's office is spreading the news far and wide so that we would have it available at more different places, and would have the other city departments announce it, advertise it also, so that people can fill it out. As of last week, we only received 40 survey people who fill it out. So there were just 40 cases, but for a city of over 100,000 people.
Yeah.
So we need, in order to make it statistically significant.
You gotta get far more, yeah. So there's gonna be a push to get the information back in from the various questionnaires.
Yes,
Yeah, okay. And the health workers will be working on that with you.
correct.
Yeah,
Yes.
all right. Any questions, Mr. Fisk? or-
No, nothing here.
Okay, all right. And then, let's see, what is next on the agenda here? The next page here?
We have some mental health.
Yeah.
Maybe we could touch on this. Commissioner Brooke Doyle has reached out to me to ask some advice on how to look at mental health in the city or across the state, because I think one of the things sometimes that has been lacking is the mental health professionals working, but looking at the spiritual component of it. And so based upon some of the connections that I have with them as the statewide advisory member and also as a clergy, I think that comes into play. And so just this week that I would say that the commissioner reached out to me to have a discussion around expanding services along those lines. And also there is training, not training per se, but an event that will be taking place in May at the 165 Quincy Street at the health department there, the mental health department, because the month of May is mental health month. Yeah. So we are looking to do different things. Hopefully we will be able to move forward with some action plan to be able to see how we can best attend to the needs of those who are mentally challenged or who need some care.
Any questions, Mr. Fisk?
Nothing here.
And then, and following up on that, because of health access, issues, mental health care access has always been a pressing issue. It's even more now since the pandemic, but also then following access with the Brockton Hospital. Last time we met, I think we were told that the timeline now was sort of December before the hospital would be fully open. Pieces are opening here and there, but the full opening of the facility is timeline looked like December. Any updates from the? I know the city's actively involved with the hospital leadership in this, and any updates that you can provide for the folks in the city.
Yes, actually, we had a meeting with them this week, and the update is basically the same. It seems that the electrical system is more challenging, and there's more damage done to it during the incident. So therefore, the delay is the opening that was foreseen for June is out of sight for now. But the CEO and the administration is looking to see how to move forward, and they will continue to keep updating us in the city. Tomorrow morning, there is a meeting in Middleborough that I will attend also with the region unit for public health issues. So I know that on their agenda, they also have the hospital. I don't know if anybody will will be coming from the hospital to speak, but I plan on attending that meeting tomorrow and get any further updates on what the plan is, whether to work with the hospital or to maybe help them to develop another strategy to help address the need right now. So I guess in the meantime, the patients continue, some of them continue to go to Good Sam, some of them go to Morton Hospital, some to South Shore. One good thing is that Brockton Hospital administration has been successful at placing some of the medical personnel at different sites. And I think of the two sites they have on Liberty Street and also at the side of the main hospital, the two units they have, the two ED departments, I think they seem to be going well. And some of the mental health individuals have been relocated. Some of them go to Good Sam, some of them have been able to have some access at the BMC unit. Okay. Yes, as well.
Mr. Fisk, any questions?
Well, I think we'll all be happy when they reopen. I know that we miss them very much, and some of what I see that's very hectic. The other hospitals have to taking in everybody, and they're working hard. So we'll all be happy when they come back in online.
I guess the only other issue on the agenda then is, that as of this point, we can continue our virtual or hybrid sort of in-person virtual meetings until at least March of next year is at least what the governor has authorized. Is it?
Yes, that is correct. Governor Haley has extended the deadline, and so therefore we have another until March 31st, 2025.
Yep.
If we so choose to conduct meetings remotely.
Yeah. So with that, unless there's any other issues, Mr. Fisk, anything that you want to bring?
Yeah, I have a couple things that I'd like to bring up. I think it was a month or two ago, Dr. Montessori, we were called before the council, the city council, and it was kind of left up in the open a little bit. I think I was wondering if our financial records or anything like that were turned over to him. I know Dr. Montessori was he had everything right there, and for some reason they didn't even want to look at them. And I wonder if they had asked again for those financial records, and what the status was on the outcome of that.
No, they have not asked me directly for any record. Basically, it seemed that the sentiment is to speak with the board, but I don't know how much time they allow the announcement to reach out to the board members. One thing I do know is there is a very strong sentiment to really to remove sanitary inspectors and make them members of or staff of the building department. So in so doing, there's a lot of changes. It just doesn't lay out in a systematic way for all of us, for me, to see and to decide, okay, in what direction am I moving with my staff? And so we try to continue to do the best we can. We do have a lot of fees that we collect here. Also violations when we cite individuals and when it becomes to monetary value. So we collect that. So we just send them over. One thing I have to say also, even though COVID has stricken, but from last year to this year, our collection has been significantly up. 2021, it was low. But when I look at what we have collected last year and this year already for the first 4 months of this year, we have made some great strides in terms of money coming into the city. But the emphasis has not been put on it actually.
I'd like to say that Doctor, you were very, you had everything there in front of you, and additional copies for the council, and they weren't taken at the time. But I said you were well prepared, and it was very nice that you were, and that type of thing. The other night, I happened to be there on a cemetery committee type of thing in regard to the cemetery, and I was called. I saw the next one was to do with the Board of Health, and I didn't know anything about it, but I did get up. But from what I understand, everything was tabled. So, but I was there. But I just,
it would be,
I wish that the Dr. Montessor, I was there. I've been around, but he's in charge of the administration, and not as much as Dr. Brophy and I are. And I wish they had talked to Dr. Montessor in regard to a lot of the things, and I think they would have found a lot of their answers that they really needed. But he did the financial statements and everything. He was very, very well prepared, and I appreciated that, and I saw that.
Thank you so much.
Yeah, thank you for representing us.
Mhm.
If they need, part of the issue is communication with us.
Right.
You just happened to be there, but you weren't notified, and I did not receive notification. So, and the notification can't be the last minute either, because both you and I have our other responsibilities outside of the board.
Yeah.
That doesn't make for potential flexibility to be there at various times. So,
We can only, it's just like, you didn't even know anything about it. And
you just have to be there. Yeah, I know. Yeah.
I was willing to have a very nice conversation with Councilman Farwell, though. I was ready. But anyways.
All right. Well, thank you. Thank you, Mr. Fisk, for representing the board at the meeting. Even though they were there for another purpose.
Yeah.
So we appreciate both of you being there. So anyways.
Thank you.
All right. So anything else?
One last thing I'd like to inform the board of. I am taking some vacation the second half of June. So I'll be going away. So I'm making plans so that I can have representation here. We do have meds for any type of biohazard issue in the city. So I will be delegating that role to another member here who has experience handling it. So if anything, God forbid anything happen while I'm gone, at least they can have somebody will have access to the meds. And 2 weeks ago, I was called up on to follow up a training, a drill at the U.S. Postal Service on Liberty Street. And that was the key issue that they discussed also. So I'll make sure that everything is in place.
Yeah.
And I am taking a trip. My first vacation since I've been here, actually, my long vacation. So I'll be traveling to Israel, leaving on June 13 to be back at the end of June.
And the staff covering, they're aware of how to contact us, and if there's any issues.
You certainly deserve it after, the COVID and everything that you stuck right by us through thick and thin, Dr. Montessor. You have all throughout, and you deserve it.
No, definitely deserve it. Not just sticking with us. You were nights and weekends on many.
And everything. Yeah.
That you didn't get any days off. So we you and your staff did a great job through all of this. We were, no one was staffed enough, but we were, with the obviously understaffed as it is, but despite that, really did a tremendous job. In the city. So,
Thank you. Thank you so much.
Yep.
Yes, I really appreciate your nice words, your kind words.
So with that, I guess, I think that's the last item. Is that correct?
Yes,
That was
Yeah.
it.
go ahead, Mr. Fisk.
No, that was it.
Okay, so with that, we'll have a next meeting of the Board of Health will be June 1st of 2023 at 4:30. With that, I'll accept the motion to approve from you, Mr. Fisk. And
Approve all the minutes today, and
yep,
we'll
and
look forward to see everybody in June.
the motion to adjourn is passed. And thanks to everyone, and we will regroup again in June. Thank you.
Thank you. Take care, everyone.
Take care.